I will begin now. I'm Elizabeth Lockwood. I'm from CBM Global Disability Inclusion, and I'm pleased to be your moderator today. This event is being organized by the Disability Data Initiative and Fordham and Research Consortium on Disability. So we're very pleased to have you, and apologies for the delay. There were some technical issues, but we are all set right now. I would like to start with a few housekeeping items. Please note that we have international sign interpretation, and we also have Spanish and French interpretation. For international sign, all you need to do is just look at the screen. And for French and Spanish, please click on the globe icon, which should be at the bottom of your screen, I believe, and select whichever language you would like, English, Spanish, or French. You do on a cell phone, you have to click on the three dots on the bottom of your screen. So I hope that is clear. If not, we can write in the chat. For live captions in English, the link should be in the chat. And I think that's it for housekeeping, and I will get started. We're talking today about disability data, and this is such an important topic because we have data, but often data are not available, or data are old, or it's not connecting to policymakers and statistical offices. There are many gaps. And there are also many forms of data that are not being recognized, such as citizen data, citizen-generated data, qualitative data. And so it's very important to really look at how we can bring all these different data pieces together in the data ecosystem. And today we're going to see and learn about two new very important databases focusing on persons with disabilities. And I think this is a great example of how we can find more data, use more data, present more data. And I come from the perspective of working from data with organizations of persons with disabilities. So I always want to emphasize that organizations of persons with disabilities need to be part of this process from the very beginning, need to input, need to lead, and that way we have more robust data. We find data that are missing and include all groups, especially those left behind, most left behind. And I will also add a point about partnerships and the importance of data and partnerships. When we have partnerships such as with universities like Fordham University, with the UN, international NGOs and others, and of course, organizations of persons with disabilities coming together, this is when we have the most success. And so with that, I will introduce the distinguished panel, and you'll get much more information from them. So I will first introduce everybody, and then the panelists will speak. We have today the wonderful Sophie Mitra, who's a professor of economics and the founding director of the Research Consortium on Disability at Fordham University. And she is the principal investigator of the Disability Data Initiative. And I'm very pleased to work with Sophie in this. And following Sophie, we have Bradley Carpenter, is a senior scientist at the South Africa Medical Research Council and part of the Sub-Saharan Africa team of the Disability Data Initiative. And then we have the wonderful Gutrid Eforia Fefome, sorry, Getty. I don't think I said that well. She is the Global Advocacy Manager on Social Inclusion at Sightsavers and the chair of the UN Committee on the Rights of Persons with Disabilities. And she is also the president of the International Council for Education of People with Visual Impairment. And then last but not least, we have Young Yi Min, who is chief of the Sustainable Development Goal Monitoring Section of the Statistics Division at the United Nations Department of Economic and Social Affairs, and a wonderful ally with us with disability data. So I'm very pleased to hand the floor to Sophie, who will explain more about these wonderful databases. Sophie, the floor is yours.
Thank you so much, Elizabeth, for this introduction. I just see a message in the queue. All right, thank you so much for your patience. And thank you so much again, Elizabeth, for agreeing to chair this event. So what Bradley and I are going to present is the work of dozens of researchers based in different parts of the world. The Disability Data Initiative, or DDI, is an international and interdisciplinary research program that provides analysis of disability data to help advance the rights of persons with disabilities. It started at Fordham University in New York City in the US in 2020 with a team of students and myself. It has since expanded to other research institutions around the world, in particular Prasho in India, the South Africa Medical Research Council in South Africa, Universidad de los Andes in Colombia, and the Geneva School of Health Sciences in Switzerland. We have also developed partnerships with civil society organizations, the International Disability Alliance, and CBM Global Disability Inclusion in particular. We're grateful to these partners as well as to the DDI Steering Committee for guidance and support. And we're also very grateful to the Wellspring Philanthropic Fund for funding. Let me start with some background. Okay, I can still see some messages about interpreters not being on screen. If the interpreters could share if you could double check that once again, that'd be great. Someone is saying only that I am on screen. So as background, disability is a universal phenomenon and disability-related inequalities are everywhere. Yet it is very difficult to get data on disability-related inequalities, especially data that can be compared across countries. At the Disability Data Initiative, we believe that making such data widely available can help inform advocacy and policies that can impact the rights of persons with disabilities. We can now produce data on disability-related inequalities that is internationally comparable thanks to progress that has been made to measure disability through household surveys and population censuses, and progress in terms of data collection efforts by national statistics offices and stakeholders. The two databases that we are about to present build upon such progress. They're available as interactive tools that empower all sorts of users to explore the data for themselves and to bring their unique perspective to find trends in the data. They were developed in R Shiny with accessibility in mind from the get-go. However, these are brand new tools, and we will work on improving them and later send you a link to a survey to collect your feedback. They are meant for advocates, persons with disabilities, and policymakers who would like to know about the availability of disability data or how disability-related inequalities manifest themselves in their country, their region, or their district. They're also meant for researchers who can explore patterns through the interactive platform. Researchers can download the entire databases as well as the codes that we have used to develop the databases and explore relationships and patterns of inequalities. All codes are available in GitHub. I will start by providing some background on the Disability Statistics Questionnaire Review database, and then Bradley will walk you through its key features. Then we'll switch to the Disability Statistics Estimates database. I'll start with an intro, and then Bradley will provide a demo. So starting with the Disability Statistics Questionnaire Review database, I would like to note that several questionnaires are available to measure disability in a comparable way across different countries, thanks to the work of the United Nations Washington Group on Disability Statistics. These questionnaires can reveal both the prevalence of disability and the inequalities that persons with disabilities face. For example, the Washington Group has developed a short set of questions that ask about difficulties in with seeing, hearing, walking, self-care, concentrating, and communication. So the Disability Statistics Questionnaire Review Database, or DSQR, tracks the availability of functional difficulty questions in population censuses and surveys, household surveys worldwide. So these include the Washington Group short set of questions and other functional difficulty questions, those that are not exactly the same as the Washington Group short set, but at least meet the recommendations of the United Nations on measuring disability in population censuses. The DSQR database includes the results of reviews of more than 3,000 censuses and surveys from about 200 countries to indicate whether they include the Washington Group short set or other functional difficulty questions. The data shows that the availability of functional difficulty questions is improving. Currently, more than 100 countries have at least one data set that includes the Washington Group short set. However, there are regional differences. For example, in sub-Saharan Africa, the availability of data sets with the Washington Group short set has grown significantly, while in Europe and Central Asia, it is still rare. So now I'll pass it over to Bradley for a demo.
Thank you, Sophie. I'm just going to share my screen quickly. Okay, there we go. Okay, so this is the landing page for the Disability Statistics Database. So if you follow the link that's on the main website, or if you access the link directly, and that's this one over here at the top, it's ds-qr.disabilitydatainitiative.org. But yeah, so this is the landing page, and we're going to have a quick look now at the Disability Statistics Questionnaire Review. The DSQR can answer a variety of questions. You might want to know something like if there are data sets with functional disability in your region, or in a different region. If you're doing global work, you want to do comparative work. For instance, if you were in sub-Saharan Africa, like I am, you might want to look at the sub-Saharan African region. So I am from South Africa, and this is my country at the bottom of the map. And we do have the Washington Group short set, as well as a few of our neighboring regions also do. So this, if I were looking to do some cross-country work, I could use this quickly and easily to find regions that already have functional limitation questions in their existing data sets. If I wanted to then look at detailed results of one of these countries, say South Africa and Namibia, I could click on the detailed results button at the top of the screen, and then I could go and select a region using the region selector. So I would go to sub-Saharan Africa, and then, for instance, go to South Africa. And I'm also going to add in Namibia. So you just type in the names and they pop up. And now, because I'm specifically interested in the Washington Group short set, I'm also going to add a filter for that. So now I'm only going to have the data sets from South Africa and Namibia with the Washington Group short set. And there are in total 19 entries. And this just provides you with a quick way to find the data. If you have a different question, though, so say you weren't interested in a specific country, but you were looking at a specific type of data set. Say if you're a policymaker looking at, where, for instance, the demographic health survey is available, trying to figure out, what countries actually have it and where is it being run with the Washington Group short set. So I'm just going to quickly reset the filters. And this time I'm going to specifically specify a data set. So when you're specifying these data sets, you can type the name. It isn't case sensitive, but it is dependent on typing the exact name. So for instance, if I typed demographic health survey instead of demographic and health survey, it wouldn't come up. But we have also added in acronyms for a lot of the more common data sets. So for instance, if you're looking at DHS, you could take just DHS and the DHS data sets will show up. I can then filter this by the Washington Group short set. And then I only see those data sets of interest to me. Yeah. And in total here, there are 17. And also of interest here is that we have a DHS and mixed survey. So this is a combination survey that also shows up. And this is one of the benefits of using these acronyms as well, because this also allows you to find these sort of hybrid surveys. And I'm going to hand back over to Sophie now. Thank you.
Thank you so much, Bradley, for this demo of the questionnaire review database. So now let's switch to the other database, that is the disability statistics estimates database. So it includes disability statistics based on data from household surveys and population censuses with functional difficulty questions that we have analyzed. It has statistics for adults age 15 and above in 40 countries and for more than 6,500 subnational areas. It covers about 30 indicators on 7 topics: prevalence, education, personal activities such as work, health, standard of living, economic insecurity, and poverty. Because there is not a single way to measure disability based on survey or census data, because it's very complex, the database provides statistics using different methods to break down the adult population into subgroups based on disability severity and type. It also makes it possible to zoom in on subgroups of the adult population based on sex, rural or urban residents, based on age group, as well as areas within countries. This is because patterns of inequalities vary based on intersectional identities and based on geography. So briefly, what do the results tell us? So the DSE database reveals that across countries, about 1 in 6 adults have some type of disability. And it shows that for certain indicators, inequalities between persons with and without disabilities are consistently experienced across countries and within countries. This is particularly the case for education and poverty. Overall, results suggest that persons with disabilities seem to be left behind and that national and local policymakers must prioritize disability-inclusive approaches to address disparities both within and across countries. I'll pass it over to Bradley for a demo of the Disability Statistics Estimates database.
Thank you, Sophie. So I'm restarting back at the landing page again. And from here, this time I'm going to go into the Disability Statistics Estimates, the DSE database. The first page that we land on when we go into the database is the cross-country estimates. And this page can answer a variety of questions, both within country and across country. So, for instance, you might be interested in poverty, as we currently have selected here on the indicators. And you might want to compare across different countries. The default selection at the moment is Kenya, South Africa, and Uganda. So looking at these 3 countries, we might be interested in, say, the disability gap, the difference between those with and without disabilities. And here we see a very clear trend. Consistently, the levels of poverty are higher for those with disability compared to those without disability. If we then want to understand better, what are we talking about when we talk about poverty, you can actually go here to the methods section, and this will open up our methods appendices. And in here, we have a lot of detail on how we've generated our estimates and what the definitions of different indicators are. So for instance, what we're looking at the moment, multidimensional poverty, is here under Appendix 5. Yes, so if we then go back to these results and say we're interested not in the overall estimate, but we're and actually look at it specifically for women. we can actually select a population group. Here we're going to select women, and the graph will automatically update with the data just from women. But you could also select a different group like urban or rural residents, or if you were interested, for instance, in adults 65 and older, could quickly and easily just switch between these. You can also look at different types of disability breakdowns. So, for instance, you might be interested in disability by type, and then you could actually compare, say, seeing versus hearing disabilities. Or you could look at the severity of disabilities. You could compare no disability to moderate disability to severe disability. And all updates seamlessly as we go. You can also change to a table view, and this maintains all the selections you've made before. So it keeps the country, the indicators, the population groups, but it will show all of the disability types side by side like this. And basically, you can take this data and you can copy it and paste it because it is actually a HTML table. It's not cooperating at the moment for some reason. There we go. So I could take that, I could just take it and paste it into Excel or into a Word document. If we then wanted to look at within country, zoom in on a specific country, we can go to the within country estimates at the top. And here we see a map of Guatemala, for instance. If you were looking at Guatemala and you're interested, say, in research on youth, maybe looking at employment and education, you could quickly come here and using the indicator selector, you could change the indicator to employment. And then you could select youth, say adults age 15 to 29, and you would get a map that shows you exactly what the difference in employment rate is across the different regions within Guatemala. Specifically, what we have is that the northern and the western countries, sorry, not countries, the divisions, I forget their specific name, they have higher rates than those in the center. So for instance, Batan's 38% compared to something in the sort of center, which is around 50%. And yeah, we can also change our selector here. So for instance, if we were looking at it to compare against no disability, we could do that, and then it will seamlessly update and show us that information. You can also zoom in on this map. So if you wanted to look very closely at a specific section, say we were interested in the central province, we could just zoom in like that. And then you can also select specific regions and say if you want to highlight those ones. And you can also take these and save them as a PNG. So you can keep them for later if you need to use them for something specific. Yeah, so this data is also, once again, available in table format. If you click the table tab, then you'll be taken to a table. And this again has all the disability breakdowns side by side, and all the subregions that you've selected. So for instance, if I don't want to look at the first subnational division for Guatemala, I want to instead look at the second subnational, maybe because I'm interested in very local policy and we need to actually look at that data, and local officials don't have that data. So we could actually take this, say for instance here, we can look at Agua Blanca, and we could go take this data to those officials and say, you know what, here's the statistics. And you can actually show them what they don't have, so that they can actually plan for it. In this specific case, for instance, we might say, I'm just going to switch to disability versus no disability, that people with disabilities, 29% of them are employed, whereas people with no disabilities, around 41% of them are employed. So yeah, this gives you just a quick and easy way to navigate this data and find exactly what you're looking for. If I then go back to the landing page, you'll see at the moment there's this download button here for the DSQR. We'll also be putting up in the next few days a similar button for the disability estimates database, and using that you can actually download the full data set if you want to conduct additional analyses, or if you have a need for instance, the confidence intervals of the different estimates that we've done, if you want to say compare different groups and look at significant testing. And now I'm going to hand back to Sophie. Thank you.
Thank you so much, Bradley. Now you've had an overview of the two new databases. I hope you spend some time to explore them and see if they can inform your work. But just briefly, to tell you what we plan for the database in the future. So the Disability Data Initiative will continue to build up the databases by adding more data sets for questionnaire review and for analysis. We'll add more indicators and analyze estimates over time, and work on providing maps at the second subnational level as well as the first subnational level so far. So feel free to share the databases with your colleagues and friends in research, policy, advocacy. We look forward to hearing back from you, and that will help us a lot in terms of figuring out how to enhance the databases in the future. And if you'd like to work with us, or if you have questions or feedback, please reach out. Thank you so much for your attention.
Fantastic. Thank you both. And in the interest of time, I will hand it over to Getty since we have a lot of questions. Go ahead, Getty.
Thank you, my colleague and friend Elizabeth. All protocol observed. I want to acknowledge the incredible work of Sophie and Bradley, and indeed the entire Disability Data Initiative team for this transformative achievement that fills critical gaps in disability data collection and utilization. These databases indeed provide insights in the availability of internationally comparable disability data, and it's also standardized disability statistics. And this is very vital for advancing evidence-based advocacy and in disability inclusive development. Thank you, friends, for this impactful development. I wish to focus on a few points on the usefulness of the databases for disability advocacy in general, and also how it could be utilized from the CRPD committee perspective, the Committee on the Rights of Persons with Disabilities. So I think that, among other things, it will help advocates to identify gaps in data collection. The DSQR, and allow me to use the short forms. So this database evaluates whether disability-related questions in national and survey censuses meet international standards. And in this way, advocates can use this information to push for better data collection practices and greater inclusion of disability-specific indicators, and this will ensure no one is left behind. It will also highlight inequalities. The DSE database provides statistics on disability-related disparities in areas like education, employment, and health. And this will enable advocates to prioritize the most pressing issues for persons with disabilities, strengthening the case for targeted policies and programs. It will also allow advocates to explore intersectional disparities, such as the compounding challenges faced by women and girls with disabilities, or let's say population in rural areas as examples. So therefore, equip advocates to move beyond anecdotal evidence to this evidence-based. Some few points that time will allow me to pick under the CRPD perspective include These databases can serve as a critical tools to promoting state compliance and evidence-based monitoring of disability rights. So, for example, supporting state party reporting. The DSQR database can help identify whether state parties are using internationally recommended disability questions, such as their census and surveys for assessing how state parties are complying with the CRPD monitoring processes, particularly Article 31, which is on statistics and data collection. It can also facilitate evidence-based reviews because it could provide a committee with reliable data to assess state parties' reports. And that will also influence their concluded observations. For instance, the DSC database's detailed indicators on employment can help the committee to evaluate whether states are upholding their commitment under CRPD Article 27 on work and employment and the other related articles. It can also enhance the specificity and relevance of the committee's recommendations through the dialogue and finally the observation. If the DSC database reveals a lack of access to inclusive education for learners with disabilities in a particular country, the committee can issue targeted recommendations to address this issue. Now, I'd like to offer a few recommendations targeting different groups for their consideration. So, to policymakers, with this, it can adopt institutionalized, standardized disability data collection by integrating internationally recommended questions, international census and surveys. This will ensure data consistency, and that would also align with disability national policies as well as the CRPD articles. To advocacy organizations at all levels, the DSC database, for instance, can drive evidence-based campaigns addressing inequalities in areas in education, healthcare, employment, as an example. This data can therefore strengthen discussions with policymakers to push for targeted inclusive policies. For the CRPD committee, as an example, if these DSC databases are incorporated in state reviews, it can enhance dialogue with states and to provide actionable concluding observations. For donors and development partners, they would need to use this as a guideline to invest national disability data systems to improve infrastructure for collecting and using data effectively. In closing, the DSQR and DSC databases developed by Disability Initiative Data Team are transformative tools that empower us to advance the rights of persons with disabilities. As a chairperson of the CRPD committee and a disability advocate, I urge all stakeholders indeed to leverage these resources to ensure that no one is left behind. And I know together we can use this database to foster a more inclusive and equitable world. Thank you.
Thank you as always, Getty. And now I will hand to Yongyi for your remarks. Thank you.
Thank you very much, Elizabeth. Sorry, just 1 second. Yeah. Thank you very much, Elizabeth. Thank you for inviting me to join you today at this very important event marking the launch of the Disability Data Initiative's new database. First, I would like to congratulate Sophie and Bradley and other colleagues on this great work. So as you all know that the Sustainable Development Goals are built on the promise to leave no one behind. So, however, for persons with disability who make up over 1 billion people worldwide, this promise remains unfulfilled in many areas due to the persistent data gaps. So reliable and disaggregated data are fundamental to monitor progress and ensure inclusive development. Yet too often, persons with a disability are invisible in official statistics, leading to policies and programs that fail to address their needs effectively. So the launch of the Disability Statistical Estimates database and the questionnaire review database represents a critical step in addressing these challenges. These two databases help fill in two fundamental gaps in our global monitoring system. First, by tracking the availability of disability questions in census and surveys across 199 countries, the DSQR database helps us understand where we stand in disability data collection. The fact that only half of the countries have implemented the Washington Group short set questions highlights the urgent need to strengthen the national statistical system and capacity. Second, the DSED database covering 40 countries and over 6,500 sub-national area demonstrates how existing data can be leveraged to produce disaggregated indicator across multiple SDG domains. However, this database also reveals a very sobering reality. The significant disability-related inequalities persist across education, poverty, and other key SDG areas. So this database provides us with the tools to better measure, track, and advocate for the inclusion of persons with a disability across key dimensions at both national and subnational levels. So by leveraging such data, policymakers and the stakeholders can design evidence-based interventions that drive meaningful change. Data is not just numbers. It's the foundation for transformative change. So we need to prioritize investment in robust data collection systems that reflect the realities of persons with a disability across diverse contexts. So the SDG monitoring frameworks must be strengthened to ensure that no groups remains overlooked. So I commend the effort of the Disability Data Initiative and all partners involved, and I urge a continued collaboration to close data gaps and empower decision-making that truly reflect the diverse realities of all individuals. As we approach the 2030 deadlines, we must accelerate our efforts. So I want to let today's launch serve as a catalyst for greater collaboration among governments, international organizations, academia, civil society, and the private partner. Let's reconfirm our collective commitment to inclusive data system and to building a future where persons with disabilities are fully recognized and included in sustainable development efforts. Thank you very much. Back to you.
Thank you so much, Youngie, and I completely agree. What a great last point to end on with the panel. I have, in the interest of time, I have consolidated the questions because we don't have a lot of time, maybe only one round. So I will ask the questions to the panel now and then have you come back. there were many wonderful comments and suggestions, so those I won't read, but others can read. But the questions are, how often will the databases be updated? Will the databases have API access? Sorry, I don't know what API is, what that acronym is. And the next question, how can you assess data quality of these data sets? Another question, how do you address inconsistencies at the national level? For example, if the prevalence of persons with disabilities differs significantly from one census to another census? That's a very good question. And how can you capture the diversity of different disability groups in your data? This is always a great question that we get. And when or will you add other countries that are not yet included? So I will go back to the panel now, if you could answer those questions. Thank you.
Well, thank you so much. So I'll start, and then Bradley, maybe you join me soon to answer some of these. Yeah, thank you so much for the many questions. I tried to answer some of them in the Q&A box. We will strive to update the database on an annual basis. And we will also aim to provide estimates over time when we have data for a given country. We will that's the plan, to include comparisons over time for certain countries, but there are very few countries that field consistent questions in their surveys or censuses over time. So we're limited by data availability. In terms of data quality, so one limitation of our work is that we have very limited information on the data collection process itself. So in the field, how was a survey conducted? How was the training of the enumerators for the disability questions? We typically have very limited information, but we try to get information on the implementation of data collection. We have information, obviously, on sample size, and we have a process to determine if a sample size is large enough to provide estimates at the national or subnational level. So that we have a lot of information about, but not so much in terms of data collection. Bradley?
Yeah. So I'd like to just quickly answer something with the APIs, because I saw it come up again in the questions now. So API is just for those who don't know, it's like a programming thing. So you can actually request data directly from our servers. We don't currently have that implemented. It is something we can look into adding. Our idea was that the platform will be the sort of main interface for people who just want quick answers to things. And if someone wants more than that, they can download the full data set. So that was our original plan, but we can look into API access as well. I'm just also quickly scrolling through the questions to see if there were any other ones that popped up. So I did see one about data for people aged 0 to 17. So our database only includes 15 plus. Yeah, I don't know if you want to speak to why, Sophie, but that's all we do have in there. So you won't find anything for children.
Yeah, so for children, because we are working with data sets that have a tool that is good for measuring disability among adults, we focus on adults. The Washington group, in collaboration with UNICEF, has developed a tool for children, the module on child functioning, and that module is increasingly fielded in surveys around the world, in particular in the multiple indicator cluster survey. And UNICEF has been doing a lot of work around analyzing that data. So if you're interested in statistics on children, please look out for the work of UNICEF.
I do see a question quickly about how do we ensure the database and platforms are accessible to people with disabilities? For example, color-coded maps for people's screen readers. So we did build the platform starting out with accessibility in mind. So it's not like we built something and then we tried to make it accessible. We started out with that in mind. So everything that we've built has been built in such a way that it should be accessible. If people do encounter issues accessing things, they can let us know. We do have a feedback email. I don't know if you want to share that, Sophie, but we do have that in place. So if you find something that doesn't work and you can't access it, you can let us know and we'll look at what we can do to improve it. But we have started out with that in mind. So from what I remember, everything can be picked up by the screen readers. If you want to access all the data, it's all available in tabular form, so you don't have to have a map to do it. And our maps are color coded already. So that will, I think, help a lot for people.
I have some more, so you don't have to read. I have 3 more, which I think we can finish with that. Thank you for mentioning the accessibility, and thank you for everyone who explained what API is. Someone asked about, actually, a few people asked about, are you using the Washington Group short set as the gold standard, and how would you address the shortcomings from this tool? Also, sort of similar, how will you harmonize the data from different questions from in the databases, and then will you incorporate data from later onset disabilities? Back to you.
So I'll take the first part of that about the Washington Group short. Well, why the Washington Group short set? So internationally, this is sort of the gold standard. We didn't set it as the gold standard. It is what people use in censuses because it's such a short form question. So obviously there are other sets. For instance, the Washington Group themselves have much longer sets, but countries don't typically include them in these censuses. They tend to stick to the 6. Although I know I have seen in the more recent ones that they've sort of amended it with actually asking a sort of lead question of, do you have glasses? And then having 2 sort of sub questions which are identical, but with glasses or without glasses. So there are obviously developments, and as these progress, we will assess them and change or add them in. And I'll leave Sophie to speak about how we integrate them, these differences.
Yeah, so we try to harmonize the data as much as possible for our disability measure, but also our other indicators. Just briefly on, I think, as Bradley said, the Washington Group short set is the tool we have at this point that is giving us an opportunity to measure disability inequalities across many countries. Of course, there are other tools, and there's not a perfect tool. But this is the tool we have at the moment to measure the disability inequalities across many countries, and we're trying to exploit the data that we have through this tool that is breaking new grounds because we haven't had such internationally comparable data. There was a question on later onset disabilities. It is rare to find information on age at onset or year of onset of a functional difficulty. So that is why we haven't produced any statistics around that, but it would be very important if we could find that information in several countries. It would be an additional layer to provide in terms of identifying different subgroups of the population based on age at onset.
Thank you. I don't think we have time to go back for closing comments, but I would really like to thank the distinguished panel, Fordham University, and Sophie, of course. Thank you so much for organizing this and all your hard work, and also thanking the International Signs, Spanish and French interpreters and the captioner. We really appreciate your help as always, and thank you to the audience. And we will share the recording, I believe. And if you have any questions, the email or comments is in the chat. So thank you, everyone, and have a wonderful day, evening, wherever you are.